There was a large study done on facelift patients specifically using. It was based out of Saudi Arabia, I think, and the doctors that did the study showed that patients receiving are actually healing quicker with less complications than patients not receiving. For that reason alone, we said, hey, I think that this is something that as a practice we need to invest in, and we have incorporated into our post-operative protocols. Hi, I'm Dr. Raghu Athré with Athré Facial Plastics in Houston, Texas. Over the last several months and probably close to about a year now, you've probably seen quite a few of our videos about Elixir MD. Elixir MD is a photobiomodulation device that is really designed towards healing, rapid healing and recovery in post-operative surgical patients. And it's really paid a lot of dividends in bringing the recuperative time down for our patients. However, the focus of this talk is about really diving into the recovery period and all the little tiny things that are being done to truly enhance the recovery period. So when we take a look at our patients today, the vast majority of our patients are actual working women. They have jobs, they go do stuff, they are CEOs, they have places to go and they have to get back to work. They really do not have the option of giving me maybe 3 weeks or 4 weeks of downtime after facelift. So this was the real primary motto and first thing that really came to our head when we said we have got to get better at getting these women back to work as soon as possible. So there's a lot of little things that are being done in this entire process to really enhance that period and make sure that our patients can get back to work as soon as possible. To give you a little bit of an example, when I first started doing facelifts almost 20 years ago, most of my patients were taking roughly about 3 weeks before they could go back to work. Today, fast forward, most of my patients are able to wear a little bit of makeup and get back to work as soon as day 8. That's a huge difference. There's a couple of our patients who've actually been able to wear makeup and get back to work on day 5 after facelift. So how do we do this? So here are the components that I think that really matter, and I'm going to go through them one at a time. So first of all, preoperative preparation. Almost all of our patients, actually not almost, all of our patients are completely prepped prior to surgery. This involves going through every single one of their medications to making sure that they're not on any medications or supplements that are going to adversely affect them in the postoperative period. In today's world, a lot of patients take a lot of different types of vitamins, and we actually go through every single vitamin to make sure that they're not taking something that could potentially set back their healing. Next, we institute all of our patients on a specific pre-operative and post-operative vitamin protocol of arnica and bromelain to further enhance the healing process. Now, once all that is done, I think the next major contributing factor in our patients is the anesthesia choice. Now, I am an advocate of local anesthesia. Now, it's not that local anesthesia is any safer or anything like that. Check out our videos on local versus general anesthesia. I think the type of anesthesia should really be tailored towards the patient. However, if a patient allows me to do local anesthesia, I do think that they heal quicker with less bruising and swelling. Their recovery period is easier. So I do think that that is a factor, and I discuss that with patients. There are some patients that say, yeah, I'm with it, let's go forth and prosper. There are other patients that say, I don't think local anesthesia is right for me, and I completely understand. So that's not the only thing that you just jam it down their throat and say, hey, I want you to heal quicker, we have to do local anesthesia. That one variable is something that needs to be customized to the patient. Now, let's jump to the post-operative regimen. So in the post-operative regimen, again, remember that we continue the vitamins that we started before surgery. Number 2, there's a lot of things that are being done in the operating room, whether they be drains, whether they be hemostatic quilting sutures. There's a million little things that are being done in the operating room to further minimize bruising and swelling. Some of the large things that we're doing in terms of services are Elixir. The introduction of Elixir MD into our practice has really brought down the bruising and swelling. So going along that further channel channel of we know that Elixir works, we started doing a bunch of research, and we are doing all sorts of things to bring that time period down even further. IV therapy post-operatively. So we're doing an IV therapy now that has certain components, including B vitamins and magnesium and normal saline and glutathione, a couple of different factors that are all designed to enhance the healing process, decrease inflammation, enhance fluid mobility, make you feel better, and heal quicker. Along with that, we've also invested in hyperbaric oxygen. There was a large study done on facelift patients specifically using hyperbaric oxygen. It was based out of Saudi Arabia, I think, and it was only facelift patients, and the doctors that did the study showed that patients receiving hyperbaric oxygen are actually healing quicker with less complications than patients not receiving hyperbaric oxygen. For that reason alone, we said, hey, I think that this is something that as a practice we need to invest in, and we have incorporated into our post-operative protocols. So to give you some idea of how important we feel that this is, actually each and every one of our patients will get an entire bag of stuff. And in this bag includes things like a water bottle, which is pre-measured with some IV hydration to make you feel better immediately after surgery. Let's see what other goodies are in here. This is a specific orthopedic neck pillow that you can use post-operatively to keep your head at the right position to help you feel better, decrease bruising, decrease swelling. Let's break this little bag down, and in here, so here's a couple of feel-good items, because part of you feeling good is going to allow you to get better quickly. Sunglasses and a scarf. These are things that you can wear so you can get up and at 'em and out of your house a little bit more quickly. And in this little baggie over here, we actually have the vitamins that I discussed earlier, as well as some arnica tea, which is also useful for reducing bruising and swelling. So this talk is really a testament to the whole is greater than the sum of its individual parts. There's a lot of things that are going on, and each and every one of these things are tailored towards each patient to really enhance the healing, reduce the downtime, reduce the recovery time, reduce the bruising time, so that patients can get back up to work, doing the things that they do and at home, daily life, all of these things as soon as possible. And this has really paid dividends. Now, one of the things that you're going to see that this is not something that I just put on, hey, I'm good enough as it is, and let's just stop that process. In the upcoming weeks, you're going to see even more things that are introduced to further enhance the healing process. So definitely stay tuned for those videos. So if you like this video, please give us a like or a subscribe. Now, if you have comments, questions, all sorts of stuff like that, send us a DM, hit it down below in the comment section. We will get back to you. If it's more urgent, give us a call. You can also check us out on our website. I really appreciate your time and checking out my video. Dr. Raghu Athré, Athré Facial Plastics.